Welcome to Jazz Area, where we discuss everything Bay and beyond. Come walk with me, 'cause I'ma make you be better. Plus gold will shine, making my life a high standard. Welcome to Jazz Area, where we discuss everything Bay and beyond. I have a wonderful guest with me today, Dr. Pringl Miller. Thank you so much for being here with us today.
Thank you for inviting me.
Dr. Pringl is a general surgeon, hospice and palliative specialist, founder and executive director of Physician Just Equity, co-founder of Surgical Palliative Care Society, and a lecturer at the University of Illinois College of Medicine. That's just a few things that you do. But I wanted to ask, what was the thought or the heart process behind choosing the medical field?
The story is that I was a very accident-prone child, and I was in the emergency department more than my fair share.
Wow.
And the good news is that I had really nice experiences for being injured and having pain and the things associated with injuries that are stemming from being a very active kid. And so I think I really just internalized how people took care of me and how I was made to sort of feel better in that period of hurt. And it imprinted on me. So I just grew from that experience wanting to probably give back in that way.
That is amazing. And it's so true that it's all about how people make you feel when they're in your presence. It makes an imprint, no matter whether you're choosing a career or to be a friend of that person or just in any way. It's very important how you treat people.
Yeah. And I was in Seattle, Washington, because that's where I grew up. So it wasn't a very diverse population.
Got it.
So I don't know by visual memory, but I think just by population statistics, most of the caregivers that I encountered were people who are white.
Okay, yeah.
And despite that, even though we know that things are not always equitable these days with healthcare, I walked away from those experiences actually having a positive impression versus a negative impression. So I feel really grateful for that.
Yeah, and not having that, I can't do that because I don't look like those people. You still had the ability within to say, hey, I can do this.
Yeah, and I also didn't feel like I was getting desperate care, which is something that I think we're going to be talking about.
Yes.
Yeah.
Can you touch on that a little bit? What is your thought process behind desperate care?
Well, to me, that just means a lack of equity and justice across the full spectrum of healthcare and what people's experiences look like.
Right.
And it has a lot of historical basis for people of color and Black people specifically not getting the same access to healthcare, but also not having the same delivery of healthcare, not having the same outcomes because of the lack of access and delivery.
Right.
And the lack of concordance is something that's been studied more and more with regard to Black people not having the same outcomes, partially because they may not be cared for by people who consider their outcomes as valuable as majority outcomes.
Yes. We can talk about a lot of that. You are a content expert and a visionary regarding equity and justice for physicians and surgeons. Can you talk a little bit about that? Like, was there any particular moment where you were like, okay, I'm not only going to have my career as a surgeon, but I am also going to help other clinicians in that area?
Yeah, that was an evolution because in the beginning, I was just so focused on my own career and being the best surgeon that I could be. And I think because of circumstance, because of my protected class characteristics, and I think to some degree just the way that I have a standard of excellence and ethics, it was challenging always to fit in.
Right.
And so as a result of that, I had various experiences that informed that not everybody in medicine and not every surgeon is treated the same way. And it just was fortuitous that I started having a conversation with a colleague who happens to be white and a woman, and she was relaying some of the same experiences as a surgeon. And then we just started a group, and then that group became an opportunity to write about it and an opportunity to edit a symposium about a lot of different people's experiences, and that just grew from there. And now more and more there's evidence that there is disparity in the way people are treated based on the way that they look and their values.
Yes.
And that's standing in the way of equity in the surgical workforce. So it just became something I couldn't not address.
Right.
I had to do something about it just because it felt like in the grand scheme of patient care and the lack of equity for patients, if we don't have equity as providers, as surgeons, we're not going to reach equity for the patient population.
Absolutely. And then I think about, we always think, for myself, we think in terms of the patient aspect of the interaction. And so you're not thinking about what that person is going through within their clinic or within the hospital. We don't think about those things. This is still a career that they chose. They are dealing with other people and other people's emotions and biases and all these different things. And then you have to come in and deal with the patient who may have a terminal illness or something like that. And so I think, we really need to be cognizant of other people. It's almost like we feel like doctors, they should just, they have this shield and they're just superheroes, but they don't have any emotions, or they don't have anything that they have to deal with.
Right. Yeah, and I think that's part of what I'm recognizing as the hard sell within the population is getting people in the population who consume healthcare to recognize that physicians and surgeons are privileged by virtue of their education and where they are in terms of their professional status, but the same societal woes exist in the profession and not in a good way.
Right. Yeah. And we need to make sure that not only are we advocates for our health, but just like you said, becoming an advocate for all facets of life, especially the medical field. We were just having a conversation, like, for some people, we're healthy and we're walking around here and we're just like do 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 do. We need to get to know the medical field. We need to get to know our physicians. We need to understand, anesthesia and all these different things that are used for, surgeries and all those things, because one day you will have to go to the hospital for something.
Yeah. Or you'll be the relative of somebody who's more fragile and vulnerable, who is not going to be able to speak for themselves, and you'll need to know how to advocate for them.
Yes. Yeah. And we just, keep that in mind, everyone. You will have to go see a doctor. So it's very important that you educate yourself on statistics, on everything that's going on, and make sure that you're eating right, you're exercising, and taking care of your mental health as well, too. That's really important. We talked about the quality of patient care. There are a few people, and you had your own ideas of this because I know it's not specifically in your area of the medical field, but Tori Bowie died after complications from childbirth. Kira Johnson, Judge Hatchett's daughter, passed away after giving birth. The mortality rate for Black mothers during childbirth is 69.9 per 100,000 live births. Mississippi being the highest in 2021, guys, 82.5 per 100,000 births. That literally makes me want to cry. Like, how, I know we don't understand all of it, but do you maybe have an idea of what's happening?
Yeah, I think a couple things. One is that Black women aren't taken seriously.
Yeah.
They're not taken seriously and considered valuable, sort of in society at large, and that translates to how they present and how they're perceived in getting health care. And so not only are there biases and discriminatory practices, there's just no oversight around it in the way that there should be to make those statistics more equitable across, different race and ethnicity groups.
Right.
So not only just is there a projection onto Black women, but then there's the lack of partnership and listening to Black women about what they're experiencing.
Right.
And we talked about how one of the papers that I wrote with my niece had to do with transgenerational trauma
Yes.
and trust, and how we used the example of Serena Williams,
Yes.
who is a high-profile Black woman,
Right.
who was presumably at an institution of her choosing when she was ill because she has access and choices.
Right.
But even in that scenario of her having a recurrent PE and having the symptoms of that and having a familiarity of what that felt like,
Right.
she wasn't listened to.
Yeah.
She was able to articulate what she was experiencing. She was even able to diagnose what she was experiencing, but the providers that were taking care of her didn't listen.
Right.
They didn't believe her, and she had to escalate. And finally, she was sort of in the position of making her own diagnosis and putting forth her own treatment plan because she'd been there before and known what was needed. So, if somebody like her can't make their concerns heard, it's pretty staggering how the average non-medical, not high-profile
Right.
person is not going to be heard. So it's a devastation, it's a tragedy, and I don't know that there are enough efforts being put forth to mitigate that terrible problem. I mean,
Right.
it's embarrassing, and it's avoidable.
Yeah. And I'm wondering, I was thinking about you. We spoke about Dr. J. Marion Sims, who is, OBGYN godfather. And he did experimental operations on Black slave women between 1845 and 1849. And I'm wondering if that's almost like the spirit of that area. Like it's such a bias that it started in. And so as Black women, if you're complaining about pain or anything like that, it's almost like I have this going on. It's like, well, no, you don't. You're fine. We can handle anything. And it's almost like they've carried his idea of that into, where we are now.
Yeah, I think it's a good point that there's some historical precedence for the treatment of
Right.
Black women, and presuming that Black women don't have the same threshold of pain and are strong and can endure. And, of course they are strong and they can endure.
Yes.
But that doesn't mean that that's the appropriate way to treat Black women.
Right.
I think that's a pervasive thought, too, that Black people in general have a higher pain threshold and can tolerate more pain. There's literature around that. There are medical students that have been surveyed around their perceptions of
Right.
pain tolerance. And even still today in this country, there are medical students that think that Black people have thicker skins and can tolerate pain at a higher intensity than white people can, or other ethnic racial groups. So it is a very deep-seated, ingrained mindset that's just not right.
Right.
And breaking sort of the shackles of that mindset and that prejudice is a heavy lift, but we have to keep on keeping on.
Keep on keeping on. Yes, yes. Could you talk about physician just equity and how did that come about, and what are you doing right now?
Yeah, I'd love to. So Physician Just Equity came about because of some of what I said before, just in terms of networking with other women in surgery and comparing notes and recognizing that we were having, many of us, the same experiences, just not being treated the same as our usually white male counterparts, and the double standard, and having people think that we were unprofessional when we were doing our jobs, and being accused of not doing our jobs because we were acting as surgeons, the way that we were trained to act, to be decisive and be people who were in leadership positions and confident. And so through the culmination of a lot of conversations and some literary works, and being targeted as someone who knew how to navigate workplace conflicts and injustices, I was doing the work of Physician Just Equity without sort of the context of the organization. And after a fair amount of vetting with people who I admire and respect about forming an organization that would actually do this work in a more deliberate and formal way, decided to do the paperwork and make it a nonprofit organization, and then it's just sort of grown since then. So as a representation of scale, we had about 12 people at the beginning. So the beginning was in October of 2023. So we just, or 2020, so we just celebrated our third anniversary. And now we have 49 people that volunteer in the collective. So we've grown a lot, learned a lot, helped a number of people, continue to help people directly through peer support. And then we're also collecting data that will help to show that people who identify as underrepresented are having issues in the workplace that don't have anything to do with their clinical, professional performances. But are impacting their ability to flourish, impacting their ability to be well at work, and sometimes even so badly affected that they're either underemployed or underemployed or unemployed. And so the through line there is really that if we are speaking about DEI issues in healthcare in the United States, and that people who are underrepresented need to be in the workforce so that they can also be part of the solution of healthcare disparity and health injustice, and we're eliminating those people, we're not going to get to the finish line of having health equity in the United States. And there are a disproportionate, I think, number of underrepresented people who are basically pushed out of their professional lives for reasons that are illegal and at the very least unethical.
And we think that that only exists in corporate America for some reason, or entertainment. There is unethical behavior in the medical field, and it is affecting patients and doctors. Patients, we only hear about these things when there's a mistake made, but we need to talk about these things. The doctors are affected too. Their work environment needs to be a healthy work environment in order for them to be able to give their patients the best treatment that they can. And people need to allow them to do that. So I love that you started that, because I'm delving into it a little more, but I've never seen like an advocate for physicians the way that I've heard you speak about it and read about it as well. I think that's amazing, and it's something that needs to be done.
The time is right now also because of the burnout issues that are happening for physicians at large. And surgeons have one of the highest death by suicide rates of any specialty in medicine. And there are just a lot of ways in which physicians and surgeons today are devalued in their workplaces. And part of that devaluation leads to burnout. And one of the drivers of burnout is unfair treatment. And so to unpack the unfair treatment, you sort of, get to the root of what we're seeing with the people that present to us for peer support at Physician Just Equity, that they're not being treated in a ethical, legal way, often not given due process within conflicts. And there's just a lot there that's unnecessary.
Right.
But there are leaders who are willing to let things get out of hand.
Got it. Yeah. And a lot of the time, those aren't leaders.
Right.
You know what I mean?
They have the title.
It's an uncovering.
Yeah. They possess the title.
Right.
That puts them in a position of leadership and power.
Yeah. That's scary.
It is. It's unfortunate.
Yeah, because, a lot of people don't understand the importance of emotional intelligence. I mean, that is critical in any field you go in. You said that there is a really high suicide rate amongst general surgeons. I wasn't aware of that. That's pretty interesting. And you said the burnout is, do you think there's, because when you have compassion for people too, I know that can be really rough if you're dealing with a patient and something happens.
Yeah.
So do you think that's a part of it too?
Yeah, I mean, I think to be a physician and a surgeon, there's a very high level of expectation.
Yeah.
And a high performance is required. And if you're mentally ill in some capacity, that wouldn't ordinarily impair your ability to practice. But on top of that, the system isn't supporting you, isn't providing accommodation.
Right.
You're not sleeping well, you're not eating well, you have too much stress. The system doesn't recognize that you're in a family structure and you need time to be with your family.
Right.
And they just want you to work. There's just a lot of variables. But if you compare suicide rates across the country for physicians or surgeons and non-surgeons, it's higher for surgeons, everything else being equal.
Right.
So it's a problem. It should really make us think about what are we not doing within the profession.
Right.
Surgery as a specialty and medicine as a profession to support the people that we really rely on to keep the population healthy.
Right.
And part of that really just stems from the tradition of physicians being godlike and not being humans.
Right.
And being held to unhuman standards.
Right.
And we are human and we have needs and we need to take care of those needs. And if we don't, then we fail.
Right.
And sometimes that failure is just leaving the profession, and sometimes it's as dramatic as taking one's life. Wow. So I think, as you said earlier, it's important for the public to recognize that there needs to be more effort in supporting the population of physicians and surgeons, because we spend a lot of time in training and we're really committed to what we're doing, but we also need to be treated in a way that's commensurate with the stress that we are under in the position that we're in. And that requires time away from work.
Yes.
It requires time to heal and rejuvenate. And I don't think any patient would argue with that. I mean, patients want their physicians at their best.
Right.
But that requires some intention.
Yes. And it's like we just completely disconnect. Get to know your physician, okay? Your surgeon. Get to know them. Don't just go and ask to get healing for something or, medicine for something. You should really know, not their personal business, but, you should really take the time to get to know them and make sure that you're not part of the problem. I mean, there's a lot. You know what I mean? You just want to, make sure that you're not a part of that problem. So, yeah. We really have to educate ourselves on a lot of different things.
Yeah, and I think it's the education is also ownership. It's feeling like you have a responsibility
Right.
to be a good citizen.
Yes.
And, that's just part of why I also did PJE, is that I felt like I needed to be a person who revealed some of what people were experiencing, because it
Right.
just wasn't obvious.
Right.
It wasn't being seen.
You were telling me about your niece. She's studying at Brown.
Yeah.
What's her name?
Fiona.
Fiona. Hi,
Yeah.
Fiona.
Yeah.
So what is going to be what is she going to go into?
So she finished her medical degree
Okay.
at UCSF.
Okay.
And that was just in the spring. And then she went off to start her OBGYN residency.
Wow, nice.
So she's in her first year of residency at Brown.
Okay, nice. Is she going to practice out here, or is she going to?
I think she just needs to get through her 4 years of
Yes.
training and then
Yeah.
see. She's the mother of 3 children,
Awesome.
and she has a wife. And so they'll need to come up with sort of the next thing,
Right.
when the time is right.
Yeah, and see
As
how
everybody, what everybody's needs are and
Right.
what's the right next step.
Yeah, that's awesome.
But I'm very proud of her, and it's been fun. She's the only one in the cohort of the next generation who's decided to do medicine. So it's been fun to sort of be on the journey with her a little bit, and also we've been able to collaborate on a few written works because her background is in poetry and literature, and so she's an extraordinary writer. So I've gotten the benefit of having her as a partner and a co-author.
Yes.
In some of our writing projects.
That's great. I also wanted to ask you about your father. He, Mr. Miller, was an artist.
Yeah.
And he was a part of the Spiral Project.
Yeah.
Do you think that has a lot to do with your activism?
Yeah, I think so. He was part of the Spiral group. It was a group of Black artists that came together during the Civil Rights era. Although I'm not sure we're out of the Civil Rights era. And
Pay attention.
I think that not only his work with them, which was actually pretty short-lived in the grand scheme of his whole career.
Right, yeah.
But I think what's also noteworthy and something that makes me really proud of him is that he ventured out of his art scene in New York to become the first Black art professor at the University of Washington. Yes. And so his ability to take that on in the late 60s, early 70s, I think is an inspiration to me.
Right.
To be able to do something no one's ever done before.
Right.
And my mother, too, was, in her own right, somebody who was very much her own person and made decisions that were against the grain. So I grew up with 2 parents that I'm very proud of and very grateful that they were my parents, because they demonstrated for me being able to do something that was unique and rare because you wanted to and because you felt it was the right thing for you at the time. So they were both strong and independent and committed to making a change. Right. And so I think that certainly factored into my ability to even think that I could become a doctor and think that I could become a surgeon and then think that I could start this organization, because I had role models that demonstrated that for me.
That is awesome. That is so awesome. Well, I want to thank you for taking your time out today to be with us. I really appreciate it. You are amazing, and I know I'm going to learn a lot more from you. And I thank you so much for sending me the articles as well. And I'd love to meet your niece one day too, and her family.
Yeah.
Yeah.
Well, thank you for having me on
Yes.
Jazz Area and
Yes.
for doing this. I think
Yes.
it's so important that you're talking to people and getting the word out,
Yes.
educating the public, and bringing issues to light.
Yes.
And it's been a joy to meet you. I'm glad that we were able to connect.
Yes, absolutely. Thank you.
Yeah,
Thank
yeah.
you, everyone, for tuning in. Have a good day.